can you tell us about the Médecins Sans Frontières TB project in India, in Mumbai?
Yes, actually we are based in Mumbai since 2003, and initially we had a project for HIV patients, and we looked at patients who were excluded from the national program because they were co-infected with TB or with hepatitis B, hepatitis C or other infections. But increasingly, during these years, we saw more and more tuberculosis, and especially drug-resistant tuberculosis. And actually we saw very fast a trend of having more and more extensive and more complex patterns of resistant tuberculosis among our patients. In fact, just following the trends, our project from an HIV project started becoming a multi-drug resistant TB program. And from HIV TB co-infection in the beginning, now have more and more just drug-resistant TB co-infection. So in fact, we see a high burden and complex resistance patterns in this project. A very important, I think, point in this project was that in the beginning we were working a bit in isolation. And this was for two reasons. First, because there was a denial in the national HIV program and TB program to accept that the epidemic was there. They were referring to some figures from a small study that it was very low, the prevalence of drug-resistant TB, both among new cases and retreatment cases. But during these years, we saw also a difference in their attitude, accepting more and more the situation. So in fact, now we work more and more in collaboration with the National TB Program. We recently did a study, and we collaborated for this study. We looked at the burden of TB in HIV patients, and we collaborated both with the HIV program and the TB program, the national TB programs, which was also for us a very positive and unexpected surprise. And even the results were not pretty, and actually were alarming, even disturbing. They were endorsed by these two programs, and they accepted this report. So this is a bit of a history of the project and how it evolved from HIV to DB and DRTB and more. Now we do XX-DRTB, or totally drug-resistant tuberculosis, and how also from an isolated, a bit out of the system, we became more and more players accepted and collaborating, etc. But we always remain a little bit, out. We want to be one step beyond. Like, for example, for diagnostics, there is this new test, Gene Expert, that everybody says that is great, and it is great. But for us, we should not rely on that, because given the complex patterns in Mumbai and in other parts of India, we want to have access to the full spectrum of diagnostics. The same applies for treatment. If we wait only for the national program to take the two new drugs, it will take more and more time. So in fact, in our program, we try to get access to the new treatment, like new drugs like bedaquiline, through compassionate use. So this is an effort, always to not to wait and not to follow a bit of the complacency that follows all over. And I think more or less these are the challenges for diagnosis and treatment. Full access to diagnosis and not just the existing treatment regimens.
We've been hearing about deadly gaps in the Médecins Sans Frontières out-of-step report. What do you think can be done about this?
Yeah, actually, I was talking before about India, but similar situation we face in other parts of the world, so what we call hotspots. And I think this report brought some deadly, as we call them, deadly gaps. And these gaps, I describe them with examples from Mumbai. There are gaps in diagnostics, there are gaps in treatment, there are a lot of outdated practices. The model of care we still use, like having only directly observed treatment and hospitalization in some cases. We also identified gaps in how the policies are implemented, and gaps also in funding for the projects themselves, the treatment programs themselves, but also for research and development. And I think our report calls actually for, first of all, to acknowledge that this is an epidemic, and the epidemic is not anymore TB, but it's drug-resistant TB, and it's getting worse, and it's getting the burden higher and the complexity also higher. And if we start, if we only look at MDR-TB and we don't look at the XDR-TB and totally drug-resistant TB, we're going to do the same mistake that we did before, that this complacency that TB is the problem. And TB is one disease, and it's just a spectrum of, from susceptible to extensively drug-resistant TB is the same TB. And we have to be able to diagnose at the outset this TB and treat also with the most appropriate regimens.